All new, it's officially May, which means we are just 11 days away from the end of the worldwide public health emergency from COVID-19. President Biden ended the national emergency earlier this month, prompting a question from an 11 Live viewer about COVID tests.
11 Live's Jerry Carnes joins us live now to talk about those free tests that we've been able to get for a while now, Jerry.
Good morning, Cheryl. That's right. In fact, they've been available for more than a year now. Despite the decline in cases, there were more than 88,000 positive COVID-19 tests here in the United States just last week. Changes are on the horizon, and so we verify what it all means in terms of free COVID tests for all of us now and in the future.
The best things in life are free, or so says the Beatles' hit song. But very few things are actually free, and that prompted a question from an 11 Alive viewer. Marlena Long emailed us after seeing commercials claiming Medicare recipients can still receive up to 8 free COVID tests. She asked us to verify. Our sources are the Centers for Medicare and Medicaid Services, the U.S. Department of Labor, and Juliet Kubanski of the Kaiser Family Foundation. In January of 2022, the Biden administration announced that Americans with insurance could get up to 8 free COVID tests a month. Kubanski and the Centers for Medicare and Medicaid Services confirm you can still get those free tests, whether you're covered by private insurance or Medicaid. However, all of that will likely change on May 11th, when the COVID public health emergency is scheduled to expire.
People with Medicare will no longer have access to free at-home testing. This is particularly true for people in traditional Medicare. Those in Medicare who are enrolled in the private Medicare Advantage plans may continue to have coverage of at-home COVID tests, but it will vary from one plan to another.
The Department of Labor is encouraging private insurance companies to continue paying for at-home COVID tests after May 11th, but confirms those companies will no longer be required to pay for them. Kubanski says if your doctor orders a test at a lab, your private insurance company will likely continue to cover it. So we can verify that, yes, insurance companies, including Medicaid, continue to pay for free at-home COVID tests, but that likely will change for many of us in just a few days.
As cases decline, demand for these tests are dropping as well. Experts suggest you reach out to your insurance provider to see if they'll continue to cover the costs of these at-home tests after May 11th. Back to you.
All right. Thanks for the information, Jerry.